Hello everyone, today we are dealing with the postnatal assessment. Objectives: to introduce postnatal assessment, to define the postnatal assessment, to enlist the purpose, and to define frequency of examination, to describe the articles, and then we will discuss the procedure and then aftercare of the procedure. Then introduction: examination of a postnatal mother and early identification of complication is one of the important responsibilities of a nurse in postnatal area. Adequate postnatal examination is necessary for planning the care of postnatal mother. Coming to the definition, postnatal care includes systematic examination of mother and the baby and the appropriate advice given to the mother during postpartum period. Postnatal assessment is an important component of postnatal care. Objectives: there are certain objectives of postnatal assessment: to observe the general condition of mother, to find out postnatal problem and manage, to provide necessary health teaching to mother and family, to improve mental and physical health of mother. Coming to the purpose: to assess the health status of mother and institute therapy to rectify the defect in any, to detect and treat at the earliest any gynecological condition arising out of obstetrics legacy, and to impart the family planning guidance. Frequency of postnatal examination is: first examination of postnatal assessment is done within the 24 hours of delivery, and second must be done before discharge, and third examination is done after postpartum. Articles: thermometer tray, BP instrument, measuring tape, clean glove, kidney tray, clean swab and gauze piece, weighing scale, back pain for mother unable to move, and screen torch. Now coming to the procedure steps that we have to follow during the postnatal assessment, that is preparation phase. First one is prepare the necessary equipment, greet the woman respectfully and with kindness, tell the woman and her support person that is going to be done, listen to her attentively and respond to her question and concern, provide continual emotional support and reassurance as possible. Ask the mother to empty her bladder and maintain privacy, wash hands. History must be collected: personal information, daily habits and lifestyle, present pregnancy and childbirth, first birth, present postpartum period, every visit, and previous postpartum history, first visit. Contraceptive history and the other interims of the history return visits should be asked to the patient. Then physical examination, assessment of general well-being, gait and movement, normal walk without limp, and gait and movement are steady and moderately placed, behavior and facial expression, alert responsiveness, cooperative claim. General cleanness, noting visible dirt and odor, check skin, noting lesion and bruises. Normally skin free from lesion and bruises. Check the conjunctiva. If conjunctiva appear white or very pale, see anemia for additional information. Vital signs measurement: temperature during the first 24 hours in the postpartum period within the normal range, and if the fever it is up to 100.4 degree Fahrenheit and in Celsius 38 degree Celsius indicate dehydration. Temperature should be normal after 24 hours with replacement of fluid. A temperature above 100.4 degree Fahrenheit and 38 degree Celsius at any time or an abnormal temperature after first 24 hours indicate the infection. Pulse: peripheral bradycardia 40 to 80 beats per minute and normal during the first week after birth, and orthostatic hypotension. Tachycardia indicate anxiety, excitement, fatigue, pain, and excessive blood loss, infection, and cardiac problems. Blood pressure And immediately after childbirth, the blood pressure should remain the same during labor. An increase in blood pressure indicates gestational hypertension. A decrease in blood pressure indicates shock, orthostatic hypotension, dehydration, a side effect of epidural anesthesia. Blood pressure vary based on the woman position, so assess the blood pressure in the same position every time. Respiration, normal respiratory rate of 12 to 20 beats per minute should be maintained. No important to assess breath sound if the mother has a normal vaginal delivery, is ambulatory and is without sign of respiratory distress. Breath sound always should be ausculted if the birth was caesarean or the mother is receiving magnesium sulfate, is a smoker, or has a history of frequent or recent upper respiratory tract infection or asthma. Important for auscultation of breath sound if birth was caesarean. Mother is receiving magnesium sulfate, is a smoker, or history is frequent or recent upper respiratory tract infection, or maybe asthma. Pain. Pain is fifth vital sign. Ask the woman about the type of pain and its location and severity using a numeric scale from 0 to 10 points. Now, B.Sc, it is the important acronym used to denote the component of postpartum maternal nursing assessment, that B stand for the breast, U for uterus, and B for bladder, again B for bowel, and L for lochia, H for homens, and E for episiotomy and perineum. Now, in the B for the breast assessment, there must be assessment include evaluating the breast in the postpartum period. The first step is to determine if the new female, that is mama, is breastfeeding or bottle feeding. This will guide the assessment along with the patient education. Breast evaluation: size, shape, firmness, and redness symmetry. Bottle feeding, lactation suppression. Teach the mother about breast engorgement. This usually occur about 72 hours after birth. The breast will be very tender with the feeling of heaviness. A firm, shrunk fitting bra is ideal for the woman who's not breastfeeding. Also, this will help the engorgement may still occur. Do not express milk as it will encourage additional production. Any warmth over the breast and stimulation of the nipples will create a flaxcent-like effect. Breastfeeding, focus on the nipples and areola. The nipples should be erected, but some are flat or inverted. Hopefully, this was identified during the pregnancy in order for shade to be placed upon them. Assess the nipple for the sign of bruising, crackling, cramping. A deep cracked or blister may indicate incorrect placement or another issues. Avoid placing warm cold packs on the breast. Mastitis infection. Nursing consideration: mastitis is an infection of the breast surrounding the ducts that characterized by fullness, pain, warmth, and hardness of the breast. Mastitis may include fever, while localizing symptoms are limited to a specified area that usually appear red and feels warm and possibly hardened. Mastitis need to be treated with the antibiotic, and patient is usually encouraged to continue breastfeeding. Breastfeeding, breast and bottle feeding. The decision to breast or bottle feed is highly personal. While the benefits of breastfeed nutritionally or physiologically outweigh those of formula, it may not always be possible or in the best interest of the mom and baby to breastfeed. The nurse role is to educate the mom and support the family in whatever choice is made, not pass judgment. Benefits of bottle feeding. Breastfeeding does not always comes naturally to all the moms. It is may have some difficult for some and may be considered more socially acceptable to weep out the bottle in the middle of restaurant various versus a breast. may be easier for moms who work outside to the home. Disadvantage of bottle feeding: no passive immunity, harder for baby to digest, expensive, especially if a specialized formula is needed, more allergies, overfeeding is easier, stool is more oral. Benefits of breastfeeding: passive immunity, easy digestibility, bonding between the mom and baby, no cost and always available at the right temperature. For the foodies, some women may enjoy being able to eat an extra 500 calories per day. Benefits of mother: release of oxytocin, the letdown causes the uterus to contract, which promotes quicker return to pregnant weight. It also decreases the risk of ovarian and breast cancer. Now, breastfeeding teaching: positioning, holds chest to chest or tummy to tummy in some way, grab under the breast and push down and out, taking the milk duct and pushing it forward, make a C hold around the areola, pull back down and forward while bringing forward. Get a nice big drop of colostrum on the nipple, trackle the lips with the nipples, slow as much breast as possible into the mouth once it open, and 5 to 15 minutes of first to prevent soreness. Start with a breast that was left from, try to feel every 2 hours. Formula teaching: ready to feed, most expensive but convenient. Concentrate to do, ever add more water or concentrate it power flow direction per labor. Throw the bottle content out after the feeding, do not save the for the next feeding. Start off small by only preparing 2 ounces at a time, no need to warm formula up. U for uterus, uterine assessment, fundus, prim or boggy, make a C shape with your hand and push up on the lower fundus. If it is not stabilized, the uterus can prolapse or fall into the vagina. Massage of not firm secure lower uterine segment. The concern is for hemorrhage. The primary causes are a distended bladder and retrained placental fragments. Fundal height, where it is in relations to the umbilicus or at the one uterus, that height 1 centimeter above the umbilicus, drops 1 centimeter or finger width. The position drops 1 centimeter every 24 hours for 10 days postpartum. Midline or deviated to the left or right. If deviated, is usually a sign of a full bladder. Uterine: after pain of a breastfeeding mom get worse. With each pregnancy, the uterus is a muscle, and the more it is stretched, the more force is needed in order to contract. Nursing consideration: a boggy fundus may be sign of uterine atony, which places the patient at risk for developing postpartum hemorrhage and other complications. Also, fundal location that lies out of range with anticipated location according to postpartum status may be another indication. Nursing consideration continue. The nurse should perform a uterine massage which promotes blood movement out of uterus and also encourage the patient to void, as full or distended bladder can impede uterine involution and contractions. The nurse is often in position as the first member healthcare team to learn of these warning signs and therefore must take switch action if an issue is suspected. Bladder that B. Ask mother when last voided. Establish a voiding schedule to prevent bladder distension and urinary statisis. Encourage mom to urinate every time before she feed baby as they may fall asleep. Possible obstacles of voiding: mother may become so engrossed with baby that she forgets to void. Internal inflammation from labor trauma may impair ability to void. Mother may hesitate to void from fear of pain, especially if she has an episiotomy or vaginal tearing. C-section patient may also have issues with voiding following removal of the fluid. Nursing intervention for the postpartum bladder care, that is bottle, teach mom to always bring the bottle which is used for perineal irrigation to the restroom to use rather than toilet paper. The bottle is filled with warm, not hot, water from the faucet and occasionally mixed with an antiseptic or analgesic solution if dared by the provider or permitted by hospital policy. Teach mother to use struct pads which contains witch hazel. A state cat may need to be used if mom does not void and within an acceptable time, usually 12 hours postpartum. Warning sign: perineal area is dark, moist, and bloody, especially when combined to urinary stasis. And now the next one is B, that is bowel assessment. Bowel in shock must moved into some strange position. Then take a stool softener. Don't want riping or the episiotomy or trauma to C-section incision. Next is L for lochia. Lochia assessment. The lochia colors, assess the color, order, amount. The lochia color should be forward in the progression of the lightness, never go backward. Lochia rubra. Lochia rubra, bright red, may have some clots, last 3 days, and Oxia serosa, that it is Lochia serosa, that pink serous and other tissues are included, and Lochia alba tissue, that is whitish color, and Lochia odor should have no odor and no fall smell or odor. A truly fall odor or change in odor may be sign of infection. Lochia amount scan, that is 2.5 centimeter saturation, and light less than 10 centimeter saturation, moderate less than 10 centimeter of saturation, and heavy pad is completed saturated within 2 hours. Postpartum hemorrhage is clinically defined as a pad saturated within 15 to 30 minutes. Clods up to cherry sized are okay. Peach or plum sized is not uh, normal, and the clot are most common in the morning following the first void due to saggy texture of vagina which released the lochia built up from the night. Episiotomy and perineum, that can be assessment by the RIDA, that is R for redness, E for edema, then E for ecchymosis, discharge and approximation. Perineal area assessment: pull the labia from the back, front to back, check the episiotomy area, vaginal tearing, look for hematoma formation, a collection of blood in between the tissues, and look for hemorrhoid developed during the pregnancy or during labor from the pushing process. And nursing intervention always help mom get up and ambulate the first 2 times after birth to assess for mobility, reduce the risk of falling, and prevent trauma to the perineum and C-section incision. Hematoma care: start with cold to stop the bleeding. Once it is stopped being warm, continue to monitor. If it get worse, that active area of bleeding is non-healing and it will need to be opened, and the active area is discovered and cauterized. May not appear so much of an outpouching as much as disfigurement. Hemorrhoids: vasculatures that forms a pouch. Color can match the skin of the rectal area and may look more like a blood blister than irritated. Severe hemorrhoids appear a grass clustered dermaplast spray, and patient may not be aware but may only know that business down there is not as usual. Then nursing intervention: sage bath, a rotating fluid that moves the water, may fit over the commode or One can be performed with no special equipment using the bathtub other than the bathing ring. The turn tub on and allow the drain to open and use a ring for circulating water. It's very shallow and only baths their perineal area. Next one is Homan signs. Assess the sign of DVT by the Homan sign. A positive Homan sign is indicative of the DVT, the deep vein thrombosis. Although it's not the most reliable indicator, all the characteristics changes of maternal clotting factors are higher than any other points as body prepare for labor. Combine this with the being in bed, especially if mom underwent a C-section, and it's easy to see why the postpartum woman is at such a huge risk of DVT. Performing the woman's test, most common performed with the woman in a supine position while laying in the bed. The calf is fixed at the 90-degree angle and the nurse manipulate the foot in the dorsiflexion movement. If pain is felt in calf, Homan sign is set positive. Sign of DVT, a sudden and unexplainable pain is usually in the back of the leg or calf. The tachycardia and shortness of breath or dyspnea from decreased oxygenation status, edema, redness, and warmth localized over the area of DVT from the vasculature built up around the clot. Preventing a DVT, dangle at the side of the bed within 6 hours, stand up within 8 hours, encourage ambulation at the first and independent walking when ready, and potential complication of DVT, pulmonary embolism occurs when a clot breaks away from the leg area and travels the lungs. The postnatal complication, it include pulmonary embolism is a medical emergency, and E for emotional status of bonding patterns. Fluctuation in estrogen level are blamed for emotional roller coaster that many moms experience after the birth. High level of stress, increased responsibility, and sleep deprivation exacerbate this, and bonding refers to the interaction between the mother and the baby. Caregiving of the self and baby is indicator of emotional status. Common postpartum assessment finding that taking in phage may be considered as a self-focused, real-lived experience. This is different from the maladaptive. Taking whole phage, a little bit about the mothers, a little about the baby. The world appears to be revolved around the baby and mother as a unit. Letting in phage, mother allows other people in postpartum blue that usually occur within the 2 to 3 weeks. The mother may be sensitive, such as crying, and during a commercial mama, that mother may be review is humorous in hindsight. And postpartum depression, when the blue moves to point where the mother can't care of herself or the baby. Postpartum psychosis, severe from the depression that uh, warrants immediate intervention when the mother harms herself or the neonate or consider doing so, typically is predictable by depressive episodes. Women intervention, the patient should fill out a form of to assess emotional risk. The form will be asked if the patient has a history of PPD or depression not associated with pregnancy. There is always a social worker available in the event that patient is acting strangely. The nurse may need to fill out a document such as risk assessment form. Physical assessment includes the general well-being, every visit, and vital signs measurement, breast examination, abdominal examination, vaginal examination, leg examination, HIV counseling, breastfeeding and breast care, complication of readiness, and mother and baby family relationship, family planning, nutritional support, self-care, and other health behaviors. Immunization and other prophylaxis and return visit. So we today we deal about the postnatal assessment, the objectives, procedure, article that used in postnatal assessment, and the bubbles key, and about the RETA. So thank you so much. Please like and subscribe this.